earlier in the day we had a in-person side event in Bangkok in APFSD, but everybody won't be able to participate in that. That's why we thought on the issue of social protection we should do it virtually so that more and more colleagues can participate. Colleagues, this in current context is post-pandemic period. The poverty and hunger rates have gone up. The income of the billionaires have also gone up simultaneously. This is a period which has witnessed increasing poverty and increasing inequality. SDG says, because this is APFSD and this is an official forum, SDG does say about social protection in many of the SDGs, particularly SDG 1.3 targets mention social protection, but we know what's happening to the SDG framework itself. By end of 2030, none of the goals will be achieved. This is something official report of SDG says of last year. And in Asia Pacific, particularly, one of the most vulnerable groups are the informal workers, and many of them are out of this social protection net. Gender discrimination lies, particularly of the women who are in the informal sector. Then the impact of climate change is something that we know. In this context, we are starting a discussion that is it a right time for us to advocate universal social protection floors for Asian countries? Friends, it's easy to say universal social protection floor for America or European countries because they are rich. Moment we start it here, government will say, no, we don't have money. Anyway, we'll listen here from several speakers. I would invite Arjun Bhattarai, NGO Federation of Secretary General of NGO Federation of Nepal, and Global Council member of GCAP to moderate the session. Arjun bhai,
Thank
over
you,
to
Pradeep
you.
bhai. Hello, everyone. Good morning, good afternoon, good evening, where you are. I don't know, but we are in Bangkok. Pradeep and myself and other colleagues. We are engaging this APSD process. Today is it's a second day, so we are engaging the site event. So as Pradeep said, already we done one side event and very effectively the summit for the future. So this is the second side event. We are doing the virtual. So thank you for joining this important sessions. As Pradeep mentioned, there's lots of issue after the COVID-19, and actually the GCAP we seriously engaging in this social protection and the other health related health rights. So this is very important for us. So thank you for joining us. So as Pradeep mentioned, there's a lots of issue on social protection. So just I want to mention a couple of data, according to ILO, I think ILO person's here. So maybe if I'm wrong, maybe he will correct or he will share the new data. As of 2020, there's only 46.9% of the global population were effectively covered by at least one social protection, while the remaining 53.1% as many as 4.1 billion people were left only this social protection or the universal health care coverage. And other reports, I saw the UNDP published report in 2023, 165 million people fell into the poverty between 2020 and 2023 as the debt serving crowded out of social protection, health, education, expenditure. So it's a big number. Despite this remarkable economic and social progress in the Asia Pacific, critical social protection coverage gaps still remain. About half of the region's population are not even covered by the one social protection scheme. So only a handful of coverage of have comprehensive social protection system with relatively broad coverage. So this is the one basic the issues, basic the information for you. Of course, there's a very prominent speaker today we have. So today our sessions started from our keynote speakers or expert Sylvia, and Sylvia is has been working since long on social protections. So she'll give a broader picture of social protection. She is an experienced analyst and published author And Sylvia has experience on like global aging, disability,
Arjun
gender,
bhai, you can
social protection.
switch off your video maybe because your voice is not coming clearly.
Really? Okay. So I'll close cover. Sorry. And she's a
Switch off your video.
the
Yeah.
fellow of International Council of Social Welfare and trustee of so many hat of the Sylvia. So, but as I call the Sylvia is our expert on social protection and working for the GCAP since long. So she started. She will start our session, and of course there's other colleagues, so I'll invite later on. But I don't want to go in details introduction of Sylvia. So I'll give the floor to Sylvia. So Sylvia, you can speak around 8 to 10 minutes. So over to you, Sylvia.
Thank you so much, Arjun. Can you hear me, everyone? Am I coming through? Okay. Can you hear me?
Yes.
Great.
Yeah, very clearly.
Oh, hello. Well, thank you so much for that introduction. I'm delighted to be here. I think there are many experts in the room on social protection. My contribution here as a member, core team member of the Global Coalition of Social Protection Floors is to just start off the discussion. And I have some slides to show. I will talk about the Global Coalition at the end of the talk and hope that those of you who are not members might consider joining, because this is the global, if you like, lobby to ensure that social protection is indeed universal, as it ought to be. And it's great that we have the ILO here too, because the ILO is the UN organization championing this very important human right, which we'll go through now. I've got some slides, Arjun. Should I show them?
Sure.
Yeah, of course.
If you
Could-
can
could
make
you-
Sylvia the co-host, she
Yeah.
can then share
Could
it.
you
Yeah.
could you make me co-host and then I'll
Yeah, just
show
a
them? Okay, because I don't think I can at the moment. I have a disabled participant screen sharing. Could you please let me have them?
Mhm. She's doing it. Yeah.
Oh, okay. But while that's happening, because I haven't got it yet, or maybe you could share them.
Yeah, now she's the co-host.
I'm the co-host. Okay.
Yeah, yeah.
Okay, let me see. Where am I? Here we go. I'll do it from the beginning. Okay. Okay. Right. So so it was a beginning slide. Anyway, so just to go through everyone here, I'm sure you probably know this, but I think it's hello. I think it's important that we just run through some ideas of the evidence base for social protection. As Pradeep and Arjun mentioned, no, hang on, I've gone into another slide. Can we go back? I don't want this one. Okay. The evidence base for social protection, which is all backed up by many reports and evidence, is that with it, we reduce chronic poverty, food insecurity, and inequalities. This is very important points to achieve the SDGs, but also to achieve stability in our countries and across the world. And the second major point is that social protection supports people's resilience as we go through so many disasters, both natural and man-made, and humanitarian crises. Without social protection, people are very vulnerable. It also safeguards for the future. And as we go into discussions about the summit of the future and how we are going to organize our world in the midst of very insecure environments, it's very important that we think about the safeguarding. And the final major point here is that social protection is a proven social stabilizer in all countries and in all regions, and contributes to good governance and a strong social contract, because it is a contract given by the government to its people. And I just want to go through really quickly these points, that it is a human right, which is in the 1948 Universal Declaration and subsequent instruments. And as we've just said, it enables access to essential goods. Why is that? Because it is secure income and secure health, enabling dignity for all across the life course, all ages. And as we've seen, it's vital to leave no one behind, which is a promise of the 2030 Agenda and of SDG 1. As Pradeep has said, COVID has been a big alarm bell. The impact of gaps in coverage has been clear for all to see. And perhaps those of you some of you know this, I think it's mentioned, only 47% of the world is covered by just one social protection benefit. And in Africa, it's less than 18%. In East Africa, it goes down to 11%. And we are facing acute food insecurity. The latest estimates are probably more than 276 million because of the wars in Ukraine and so on, and difficulties of ensuring food supply. So this is a slide, it's a bit complicated, but it's been mentioned, so I'm going to show it. It's how social protection contributes to all the goals of the Sustainable Development Agenda. And I've picked out a few here, obviously SDG 1, where it's mentioned, SDG 2, hunger, both of these are being discussed this year by governments at the high-level political forum. SDG 3 is health. SDG 5 is to ensure equality and empowerment of women and girls. Money in the hands of women goes a long way. SDG 8, decent work and economic growth. SDG 10, reducing inequality within and between countries. This is very important. SDG 13, the link between social protection and climate, is being explored right now. And SDG 16, peace, justice, and strong institutions, both these goals are also being discussed at this year by governments for SDG implementation. So you might say that states are both obliged to put social protection on the table, but they are not doing it. And this second point here is the flaws of social protection, which I think we'll have a quick look at, because this is a very crucial recommendation for this region. And all multilateral institutions are bound by international treaties. But what I mean by that is IMF, World Bank, and so on. Are they doing it? I think we need to think about that. And if not, work with them. So what are the flaws? Well, for those of you who are not aware or clear about it, target 1.3 of the SDGs is a very clear one, and we are far away from it. It is essential healthcare, including maternity care, which is available, accessible, acceptable, and of quality. It is basic income security for children, a child benefit at a national defined minimum, which helps provide access to essential services. It is basic income security for those in active age who are unable to earn sufficient income, in particular in cases of sickness, unemployment, maternity, and disability. And it is basic income security for older persons. This is the content of the floor. And if countries in Asia are not providing it, they should be, because their governments, all governments, are committed to this. So we've talked about only 47% of the world has access. Well, the ILO, and Marcus will talk about this, has done a wonderful work to measure how countries are doing. And you can see this in their dashboard. There's a link here, and I'll send, actually Pradeep has got these slides, so he'll make them available to you. But just to pick out, for example, only 45% of mothers with newborns receive a maternity benefit. Only 35% of employed population are protected in the event of work injury. Less than 66% of the population is covered by a social health protection scheme. This means, if you look at this dashboard, we are failing our people. Our governments are failing us, and it's important that we draw their attention to this. So, just to recap, why is action necessary? Half the global population is being denied social protection. There is weak political will. Despite obligations, there's lack of financing and technical capacity. There are instruments that promote the right to social protection, but they are not being ratified. Pradeep mentioned informal workforce. Very important. 2 billion workers globally are not in receipt of social protection. Universal social protection is compromised by national constitutions and laws that restrict reach to the few, which are defined as the poor, the poorest of the poor, the vulnerable. They are means tested and fragmented and siloed programs with short-term and insufficient funding. Donor-led programs do not necessarily support national visions. So what are we doing? Well, the Global Coalition of Social Protection Floors, which I hope you will all join, brings together currently over 100 of us from all over the globe. And we work to promote these human rights guarantees across the life course in all countries. And our vision and work can be seen in this website and also our own website. We promote in
Can you
particular,
conclude in a 2-3 minutes?
yeah, we promote in particular the implementation of ILO Recommendation 202, and we're calling on all the world's governments to ensure they expand and improve them with money. Is it affordable? Yes, it is. But what we need to do, I'm going to run through quickly, we need to use our evidence for advocacy to set up universal social protection floors with the inclusion of all the people who have the right to them, with partnerships. And this is how we might do it. We start dialogues. This is an ILO slide, I think. We identify gaps. This is what we might do together. We cost schemes, and we agree through social dialogue. But what we want to do is put in place a solidarity-based global fund for social protection. So this would be very useful to discuss, because this will provide co-financing and facilitate access to technical support. So the opportunities for this are now. We can, in the VNR process, for the Summit of the Future negotiations, for work within the coalition, and there is now a campaign for the right to social security, which you can also join. So all of these are opportunities to make sure that governments actually deliver the right we all have to universal social protection. And with that, I will finish. I'm sorry I went on a bit long. Thank you, Arjun. I've now finished.
Okay, thank you, Sylvia. Actually, Sylvia brought lots of global context and what about the social protection clause. So how we need to engage in future. So thank you, Sylvia. So it's a very important to understand what's going on the globals, and I think it's better to we'll continue keep continue to understand. Okay, so now I want to invite Marcos Ru. Marcos work to ILO and as a regional officer at Bangkok. So thank you, Marcos, for giving time. And he is sharing about the state of social protection in Asia and Pacific. So it's a very important because we are having this APFSD. So what the situation in the Asia Pacific? So Marcos, over to you. So you have a time 8 minutes. So.
Thank you, Arjun. Thank you very much. Ladies and gentlemen, dear participants, it is with great pleasure that I'm taking the floor to represent the ILO Decent Work Technical Support Team for East and Southeast Asia and the Pacific. Following 2 decades of relatively strong economic growth in the Asia and Pacific region, COVID-19 struck, sending a powerful reminder of the persistent and structural challenges faced by the region. With many countries not being able to convert the economic growth they are enjoying into quality jobs and generate stable incomes, even before the crisis, around 930 million workers in the region were working in various forms of vulnerable employment. For example, as own account or unpaid contributing family workers. The region is home to a staggering 1.3 billion informal workers, representing 68% of the total workforce. And most of these people, unfortunately, work in very poor conditions with no or only very limited access to social protection. And it is also important to note that gender inequality remains a central characteristic of labor markets, with women receiving lower pay than men and spending more time in unpaid care and family work. Now, despite some progress being made in recent years and the increased attention paid to social protection in the region, the stark reality is that 55.9% of the population still do not have access to any form of social protection. And only 54.7% of people in the workforce make payments to a contributory scheme. I think it is safe to say that the COVID-19 pandemic has once more exposed the costs of having so large a percentage of the population being uncovered, particularly those working in the informal economy. It's also important to note that social protection in the region needs to respond not only to the pandemic and its aftermath, but to other major trends as well, including population aging, migration, urbanization, technological progress, disasters, and climate change. Among these demographic transformations, such as population aging and changing family structures, including a shift from extended to nuclear families, and migratory flows place pressures on families and pension systems. And the region's vulnerability to climate change and natural disasters calls for social protection measures to improve its resilience. These developments also affect the traditional role of families and communities in social protection provision, adding urgency to the imperative for the establishment of public social protection systems, and thereby modifying the debate on the region's future. I would also like here that many countries have responded decisively to the COVID-19 pandemic to ensure that people can effectively access healthcare while supporting jobs and income security for those most affected. Ladies and gentlemen, as the World Social Protection Report 2020-22 and its regional companion report for Asia and the Pacific put it, the region stands at a crossroads. Countries can use the policy window priced open by the pandemic and build on their crisis response measures to strengthen their respective social protection systems and progressively close protection gaps. And it is indeed time for countries in the region to make their choice between different development pathways. The ILO advocates for the application of the high road strategy with a significant new role for social protection, setting out to be more inclusive and leaving no one behind, while supporting greater growth driven by domestic demand and contributing to further development of human capabilities. The other option is to focus on fiscal consolidation and pursue a low-road approach that keeps countries trapped in a low-cost, low human development growth pattern. Ladies and gentlemen, considering the nature of the reforms required, social dialogue needs to be at the core of the process, with strong participation by social partners, ensuring the involvement of both those contributing to and those benefiting from the system. Meaningful and effective participation by workers, employers, and other stakeholders not only helps ensure that social protection responds to people's needs, it is also key to building trust, public support, and a sense of ownership, thereby facilitating the implementation of policies. Unfortunately, up to now, social protection has been, for many countries in the region, a residual element of public policy, mostly limited to supporting the most vulnerable, rather than a developmental tool to enhance both economic development and resilience. But only if it is recognized as an integral part of a renewed socio-economic model can social protection achieve the policy and fiscal space it needs in order to have a transformational impact on societies. Equally, by occupying a more central space in public policy, enhanced social protection can support the social contract and generate public trust in the state with a positive impact on social cohesion. The provision of more inclusive and adequate social protection can also contribute to building human capabilities and enhance productivity, thereby generating conditions for the generation of increased government resources through both taxation and social security contributions, and thereby enlarging the fiscal space for redistribution. Without this positive transformation and an overall increase in the fiscal resources allocated to social protection, the objective of universal social protection will remain a mirage, will remain unattainable for most of the countries in the region. Today's transformations require new adaptations of social protection systems to ensure they can continue to play their protective roles for workers already covered and expand to cover additional workers while facilitating the transformations of societies and economies and creating a bridge for a future that works for all. High levels of informality and the prevalence of new forms of non-standard employment require a context-specific mix of traditional and novel approaches to ensure that all workers have access to social protection. Linking different policy areas and strengthening synergies between them can generate multiple positive spin-offs. For example, linking social security institutions with tax authorities would have the potential to generate new ways to expand coverage. At the same time, linking training and skills upgrading programs with social protection can help to develop the productivity of workers and enhance their employability. Enterprise formalization is another important step towards the extension of contributory schemes. The cost of formalization can represent, particularly for micro and small enterprises, a disincentive to move towards formal arrangements. A successful strategy for formalization should therefore take these considerations into account and develop a full package of incentives as part of a comprehensive strategy that could include support to increase productivity, access to credit and simplified tax and contributions assessments, as well as access to social security coverage, potentially facilitated by digital technologies. Ladies and gentlemen, realizing the important role of social protection as a social and economic stabilizer, countries should seize this opportunity to make the human right to social security a reality for all. Recovery will only be sustained and future crises mitigated if countries move towards comprehensive, sustainable and shock responsive social protection systems. Social protection systems and policies that enable people to better navigate life and work transitions, structural changes in the labor market, and systemic shocks respond better to the ILO's call for a human-centered future of work and contribute to the achievement of the 2030 Agenda. Investing in universal social protection is the ethical and rational choice, the one that paves the way to sustainable development, decent work, and social justice. And on this note, I would like to thank you for your attention.
Thank you very much. And really, it's not only situation you cover, like you cover like many policy and then partnership, participation, many issues. So thank you very much. So of course, the next our speaker also connecting the different issues. So there's a like climate change and other issue related to the social protection. So with this that next speaker actually talking more about the climate change issue. So he's Ranjan Panda from India. He's a climate change expert, and he's talking more how climate change is affecting food production and agriculture in India. So Ranjan, it's floor to you, and you can talk 5 to 7 minutes and share your some best experience engaging in the climate change and some maybe worst situation or impact of the climate change. So over to you, Ranjan.
Thank you. Thank you, Arjun, and thanks, Pradeep and friends. It was wonderful listening to some of the very well-meaning, great presentations. I think some of the points that actually struck me during the previous presentations, like, mm, the climate variability and the kind of impacts and how that we can link to the social protection measures. And also, I think Marcus' point on how social protection is being actually talked about mostly as a residual policy issue. It's not a primary, not a front runner in policy making. So I think that with that note, I would say that time has come that we integrate climate impacts with social protection with much more, rigor than before. Looking into the Indian context to begin with, the Indian farmers, for example, who produce the food, and you must have heard about some of the recent agitations, the minimum support price related agitations that is going on, that's in fact continuing, uh, is for a country where we feel that we are actually a food secured country. So it's like there is no food crisis because we produce a lot of this staple food, wheat and paddy. But unfortunately, these are the two crops which are also the most impacted by climate change, in the country and elsewhere. It's not in India alone, everywhere. And they're also to some extent climate culprits. I think that having said that, something that Indian farmers are suffering at the moment, for example, the producers, the food producers, and something where they don't have any sort of solid policy backup for their own social protection, is the kind of policies we promulgate, and considering sort of social protection as just a very, very narrow sort of entitlement issue. So it's a right, and it's a right of the farmers to be secured by food, water, and other services. And then that is something I think we need to discuss more. Coming to the climate change impacts, I think Indian farmers are mostly dependent on the rainfall. That's the Indian summer monsoon that almost provides more than 85% of water to the farmers. Of course, statistically, irrigation wise, I think the government claims that we have 60% irrigation, but then there are a lot of issues in that, and more than 50% of Indian farmers are still, rain fed. And this is also the place where, despite of all the progress, what Pradeep was saying at the beginning, the skewed per capita income scenario, the farmers are basically very poor in a sense. Almost 86% of them are very small and marginal farmer. That means they own a very, very marginal proportion of land, which doesn't even sustain them uh, you know, you know for their regular income and livelihood. Leave aside other requirements. So that's the reason many of the Indian farmers are also migrant workers. In fact, during the last few years, uh, farming farming population has in a way statistically changed. More farm laborers have actually are in farming than the farm owners. So, one major culprit to that can also be can also be called climate change, and the increasing, sort of increasingly unreliable production in farms. And to that, I would link to monsoon, which has become very erratic. In fact, during the last 30-40 years, things are very drastically changing with rainfall in India. And accordingly, uh, there is a very new phenomenon that is increasing, that is called the extreme precipitation events. So earlier we saw droughts, for example, but we thought that we will cover that with irrigation coverage. And some adaptation measures were already in place for the farmers. But but now the new thing is rainfall hasn't actually decreased, but then the number of rainy days have increased. And that means new forms of crop damage and new forms of sort of diseases for the crops, and also related aspects are changing the farmers' fates. So that is actually one of the major challenges that I would say at this moment, that India and maybe other places are suffering. And I'm not going deep into the statistics at the moment within 5 to 7 minutes. But then there are certain issues I think we should, as a collective, we should now start thinking. I'm very much for more research on this, linking climate, the SDG 13 to protection. So water something should also be brought into the debate. SDG 6 is also something that should be brought into the debate, and more and more farmers are not only getting deprived of water for the farms, but they are also living in water crisis areas, and more people are going to suffer due to water crisis. So water for farms, water for your own domestic use, if both are not secured, then lot of other social protection measures also become very difficult to ensure. And something that I would relate to that is the increased migration and displacement. So climate change is also displacing a lot of people. Lot of farmers are actually shifting. In fact, many farmers in India would be both farmers and migrant workers at the same time. They would be for some time farmers, then they would be migrating out for the other time. And their social protection is a very critical sort of area to understand. So what they have got in their own native areas, and what they are getting in the places of the destination of their migration, these are all very interrelated and complicated issues. So I think that is where the policies need to be backed up. And we currently, I don't think we have proper policies, and we are not linking those to many of the other global mechanisms and sort of
Can you wrap up,
conventions that we have signed. So I think one thing that we also now need to work on is basically we need to link climate change, water, and food security issues with several other kind of global conventions and mechanisms. I think very rightly somebody said that you are also trying to work with the UNFCCC process, but I think we should try to basically work on more. There are also like I am part of another collective which is working on climate migration and displacement, and we are also talking about advocating for regional approaches to providing climate justice to climate migrants and displaced people, the refugees. So I think somewhere down the line, we should think of, linking all these issues together and think of an universal, as Pradeep was rightly saying from the beginning, Asian countries, for example, would be having different kind of needs than the European and other, the American countries. Africans will have different kind of need, but there are regional issues. And then one more, the last point that I would say, there's a new thing, not new, but something that we should be very concerned at the moment is, sort of the security challenges, basically the human security challenges due to climate change, and that is also very much critically linked to your protection. Like we have come across news how uh, you know uh, refugee camps, how people are being treated, what kind of policies they have. So there are special needs for social protection, and other protections in different setups. But there are certain regional cross-cutting issues, linkages that we need to build on. So I think I would just like to conclude with that. Thanks so much again for inviting me.
Okay, thank you, Ranjan. Of course, there's many issues related and connected with the climate change and impact of the climate change. So thank you bringing these all issues, and of course we'll keep continuing discussion on climate change and the social protection. So now I will invite next speaker Becky Malay, and Becky is a civil society leaders and expert in SDG and many agenda. So she is speaking how the Philippines in shaping the social protection floor in Philippines. She represent Philippines rural reconstruction movement. So over to you, Becky. So time is 5 to 7 minutes. Becky, are you here?
No, I cannot see her.
Okay, so I can keep on next. So now I want to go to Nepal. Okay, so this is my country, and here I think is a more discussion on like impact of the debt, public service in the Nepal. So speaking by Saroj Pokhrel, head of the program and policy of Action at Nepal. So Saroj, sir, over to you.
Thank you, Arjunji. Hello, everyone. I'm Saroj from Exonet, Nepal. Just, I have provided one topic around the especially debt crisis, the impact of the debt on public services, especially. We have that was not not enough experience around the debt and public services in this time, but I am going to present something that we have been experiencing and feeling while analyzing the database that is available for now. Though the debt to GDP ratio is not extremely high yet compared to the other many countries who are in the debt stressed for now. But when you see the phenomena, the current phenomena, the debt to GDP ratio has significantly increased. During I think 2014-15, it was around 20% debt to GDP ratio. Now it has jumped up to 40% in 2020-21, and it has been reached around 44%, more than 44% in recent years. So and other things that we have been witnessing that the composition of the foreign aid has been largely changed. Before it was much more around the grant. Now it has been shifted to the loan. So declining, significant declining in the grant and rising in the loan is another phenomena that has forced to the country to arrange the debt servicing kind of things. So this is the another phenomena that has we have noticed for now. And when you see the rise in the debt outstanding, the performance of economy has not been improved. As Nepal has been receiving the money, different types of loan, and it is always discussed that the performance of the economy, the utilization of those loans is not that much going good. So there are the another area, so that in compared to the mobilizing the aid and especially loan, the improvement in the production sector, export, this thing has not been stimulated for now, and so that the repayment of the loan and debt services interest is becoming another issue that we have been facing these days. And it is a more worrying phenomena is that the revenue growth has significantly slowed down. When you see the recent economic situations, it has really the slowdown and deteriorating the economic conditions in terms of the production, in terms of the export of the good and other things from Nepal. So and even the production to sustain the local needs is not it's also not been significantly increased. So this is the another area that we have noticed. With the growing aid, especially foreign aid in terms of loan, it comes with the conditions. So especially from the institutions like IMF and World Bank, we have some conditionalities, especially austerity measures on public services, public service wage bill. And it restrict to allow the investment in the public services. So it has a larger impact on public services like health and education. So this thing, which is another phenomena that we have been witnessing since a few years. And when we see the allocation of the government allocation in the public services, especially health and education, is quite insufficient. When you see in the education sector, it is only 11%, and in health, it's around less than 5%. So we need double allocations, at least double allocations to improve the right to education and right to health as per our constitutions. So this is one thing that we have been witnessing in this area. And for the way forward, I think it is important to acknowledge that the especially debt relief program need to be demanded by the lower income country like Nepal. This one thing it need to be, and we need to be very clear around the the movement on debt cancellations, so that developing country like Nepal can invest on public services, this is especially health and education. Another part of things is country like Nepal, we need to increase our economic performance so that we can utilize the available resource from the aid, from the loan and grants, to revitalize our economy so that we can make our capacity to repay the loan and interest. So this is things that we have been experiencing for now. Though the Nepal's condition is not that much worry about the debt status, and the debt to GDP ratio is not that much high. It's reached only around 44% in compared to the other country. But we have the capacity of the repayment of the loan and interest is quite low, and it has significantly impacted to investment in the public services like health and education. Thank you, Arjunji. Over to you now.
Thank you, sir. Actually, it's very important to know the depth and current situation in Nepal, because sometimes the discussion going on whether we can go in the like same way of the Sri Lanka, or we are changing our strategy. So it's of course it's it's connected with the like social protection. So now again I like to invite Becky Malay. Becky is representing rural reconstruction movement of Philippines, and she's sharing what the situation of the social protection floor in Philippines. So Becky, over to you. You can share in the 5 minutes. Yeah.
Okay, thank you very much. I'm sorry I had to step out for a bit and missed my chance. So, in terms of social protection, in the Philippines, there is relatively a good framework for social protection. So there are conditional cash transfers, unconditional cash transfers. So it keeps the vulnerabilities, the vulnerable sectors, protected in some ways. But we still need to expand the coverage for these kinds of cash transfers. But it's good that it's there, and also it has been existing since I think 2009, continuously upheld by governments and actually being budgeted for. So we want, of course, to increase the budgets for this in the expenditure program of government, but nevertheless, it exists, and we still need a lot of improvement to be done. But one of the other areas besides the cash transfers and the ways to reduce vulnerabilities, what the government has institutionalized is a good health insurance system that covers all senior citizens. It is free for all senior citizens. If you're a senior citizen, you don't need to contribute anymore, because the state will give you access to coverage. No, so it's covered by local governments and national government budgets. So that's a good sign. And then we also, as civil society organizations, pushed very hard for the universal health care law, which already passed. So about 3 years ago, no, 2019, I think. So anyway, the law exists for universal health care. And this mainly covers insurance again, but nevertheless, the good thing about it is that in terms of fiscal management, the monies that go to universal health care come from sin taxes. So we increase the government, we ask the government to increase the taxes for tobacco, for sweets, all this harmful food, and therefore the taxes for tobacco came a bit higher, and that was reallocated or allocated for universal health care. So those are the positive aspects of social protection, but we still continue to advocate for wider, cast the net wider for everybody, for all the vulnerable sectors to be covered. So it's a continuing struggle still, because for the workers, it's still another issue, not only social insurance for the workers, but also, wages that need to be negotiated, decent wages to be negotiated. So that's it for now.
Thank you, Becky. Thank you. You share, of course, there's it's still a good situation, but there are many left behind on the social protection. So, there's the next speaker, more going to like marginalized communities and Dalit and other sectors. So they're very important part, like the engaging the social protection. But however, in even Nepal, like there's the social protection led by the contribution base. So it's always like the poor people not getting the not covering from the social protection. So I'd like to invite Beena Palikal from the Asia Dalit Rights Forum, and she's speaking more on stay up social protection of Dalit community in South Asia. So Beena, over to you. 5 minutes for you.
Thanks, Arjun. I'm not well, so I'll speak quickly. Maybe in 5 to 6 minutes, I'll try to finish. All of us saw that during the COVID, what happened in India, and I'll speak specifically on India. It's really nice to know from Becky that in Philippines, they do have such strong social protection laws or policies, whereas in India, it's a bit different. When during COVID, we saw hundreds and hundreds of people packing up all their belongings in a little bag and walking back to their villages. These were scenes that we had seen on TV, in papers and magazines, and were shocked by these scenes because these people were going back to almost nothing. They were going back to their homes without a job, without a livelihood, not knowing what is going to happen next. And we always wondered that, how is it that their life's worth and what they worked for fit in that little bag on their head? And how did that we come to a situation like this where if you look at the poverty figures and if you unpack those poverty figures, you will know that who the poor are, or who, where are the marginalized communities in this indicator of poverty. And you'll find that most of the people who are below poverty line are from the marginalized groups of Dalits, maybe lower backward classes, and tribals or Adivasis. So when these people went back to their villages, many of them were unemployed. The next employment they got is when the lockdown was, when the government announced that the lockdown had stopped, and then people slowly started coming back to the urban again in search of jobs. Now, what that really brought out was the fact that there was a lack of social security. If they had some social security, and we spoke to many community members at that time, telling us that even if they had some social security to go to the hospital or to make sure that they're able to, sustain for 1 month or a few weeks till they find something else, they had absolutely nothing to go back to. And during that time, there was increase in violence when they went back because, everybody was without jobs. Many of the men went into drinking. People were coming back into this small little house because, so many, even the children came back from colleges or schools. So everybody had to live in this little space without being able to go out. And the fact that there was no security for them increased, violence as well and atrocities. And we saw this in great numbers, and all of us know of this. So from then on, or even before that, there were a lot of groups that are asking for a minimum social security that has to be provided. And from our perspective, what we're saying is that there has to be a social security for Dalits and Adivasis, because if you look at what they're paying as taxes, if you see that the income of the country is mostly got from indirect taxes, that all the people, whether poor, rich, all pay the same amount of taxes, indirect taxes, and that's how the revenues of the government increase. And so we must take into consideration that what is the government's role in protecting and promoting a constituency and a group of people that have been keeping this country alive by they're in construction work, all the lower jobs that nobody would do is being done by people from the community. So it's really important to have a social protection in the budget. This year's budget, we have analyzed the budgets and we have seen that there is no system like to put a certain budget, like what Becky was saying. In the budget, there should be an allocation for social security that is missing in the whole budget. I don't know, many of you might know, but there is a specific budget component within the larger national budget specifically reserved for the Dalits and Adivasis. And within that, they have many schemes or many programs for promotion, poverty elevation programs, but there is no specific allocation for social security for the Dalits or the Adivasis. And so that is how, one is definitely have that policy. Two is definitely have that specifically for a budget allocated so that they can meet these expenses. They cannot say that there is no money there. There is a lot of money there. And of course, I think that it has to become a policy where we feel that, I don't know what is the type of calculation that we can have, but something that the people can sustain even during times like this, where if a COVID hits, or as we know, I think the earlier speaker also spoke about how climate change impacts. Many of this we know that when disasters come, or when there is both man-made or natural disaster, it is the most marginalized that is impacted first. So our demand has always been that we have to include this in the budgets and make sure that we have that as a program so that everybody can, and it should be the role of the government to ensure that there is social protection for the most marginalized. Thank you.
Thank you, Bina. Thank you, Bina. And of course, that's very important to more policy reform for the to cover the social protection of marginalized communities across the South Asia, mostly the Dalit communities. So now I like to invite Dr. Manpreet Kaur. He is more talking on the universal health coverage in Asian countries. So Dr. Kaur is an expert and professional in the health sector. So he will share the more related on the health coverage in the Asian countries. So you have 5 minutes, Dr. Kaur.
Thank you, Mr. Arjun. Good morning, good evening, everyone. I'm Dr. Manpreet Kaur from Health Parliament. Mr. Arjun, I would like to present a PPT. So if you can, could make me co-host.
Pradeep, can you share the co-host?
I'll make you.
Yeah, I'm doing. Thank you so much. Thank you.
No, I think Pragati can make you. Pragati, can you make her a co-host?
Yes, I'm doing. Yes, Manpreet, you are now co-host. Thank you so much. Thank you. I'll share my screen. Topic I have been allocated is on the state of universal health coverage in the Asian countries. Before I start, I would like to thank you, Global Call to Action Against Poverty, for the exemplary leadership and for the pioneering work they are doing to address the poverty and inequality, and also Mr. Pradeep for organizing such a powerful platform and to bring in experts from all the areas to talk about such an important topic of universal health coverage. And also thank you for giving us the opportunity to collaborate on and allow us to write a paper on the state of universal health coverage in Asian countries. So before we talk about that, I want to first start with why universal health coverage. So for this, we have to walk down into the history. So in 1948, when the World Health Organization's constitution, the health was made as a human right. And fast forward 1978, in the Alma Ata Declaration, the first time the primary healthcare was talked about. And I think that was a start of the universal health coverage. In the primary healthcare, how they defined it is that it should reflect the economic conditions, socio-cultural and political characteristics of a country. It should have promotive, preventive, curative, rehabilitative services, and it should be based on the collaboration across all the sectors. And it requires the community effort, individual self-reliance and participation, and reliance on the health workers as well as the traditional practitioners suitably trained locally. So here we can see that in this definition, the basics were talked about. Now, the fast forward 2000 and the Millennium Development Goals, we somehow narrowed down our focus, and we only were talking about child mortality, maternal mortality, which were more like, you know, at that time it was more important because we were seeing the high incidence rate of the child mortality and the maternal deaths and HIV/AIDS and malaria. Now then, 2015, the universal, when we framed the Sustainable Development Goals, we again talked about directly universal health coverage. In the SDG 3.8, we said universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. In 2024, it is 46 years since Alma Ata Declaration, and we are not able to address the basics of health. So, like, you know, if you see that when we are saying the universal health coverage, the world is measuring the universal health coverage on the basis of only few parameters. It is the coverage of essential health services. So in primary healthcare, we said that it should be based on the in the local circumstances of the country. So I don't know how we are saying, like, justifying the essential healthcare services and the proportion of the population with significant household health expenditure as percentage of total household income or expenditure. So I think when we talk about the universal health coverage, we should start with the basics of the health. So in our research paper, we came to conclusion that the several Asian countries face a substantial risk of pushing their populations into poverty due to high out-of-pocket health spending. So most of the Asian countries now lie in are either low-income countries or low-middle-income countries. And speaking from the personal experience, so I belong to a very middle-class family in India, and we are a very close-knit family group where, you know, the brothers, sisters, and the father, mother live together. So recently, my father is a comorbid. He has diabetes and hypertension. So when when there was the year, at the time of the year when the insurance company asked me to renew the insurance premium, it was huge expense for me personally. It was 65,000 INR, which it comes down to 783 USD. So given that 2,500 the US dollar is the average income of an Indian, so this is the 50% of I consider myself as the average income bracket. So this is the 50% of my income. So how would I afford? Just a single healthcare expense would push me into the poverty line. So here comes the role of government. So in our research, we came to conclusion that in Asian countries, the higher health spending by the government per person have, like, you know, they have lower out-of-pocket expenditure, and this again emphasize the how much critical it is for the government to spend on health, and they cannot backtrack from their responsibilities when it comes to providing this the social protection, the universal health coverage to their population. So the government health expenditure continues to play a pivotal role in enhancing health outcomes and achieving universal health coverage. So in this regard, the few extraordinary healthcare models emerges. So one is the Sri Lanka's universal health coverage model. So in Sri Lanka, when we compare with the other South Asian countries, their health indicators are much more better than other, like, you know, Bangladesh or India or maybe say Nepal. So why Sri Lanka's universal health coverage model is better than other South Asian countries? So basically here in Sri Lanka, what they do is that first they have rejected the social health insurance model, and they rely basically on the combination of general tax revenue to fund services for the less well-off and private provision for the wealthier. And the government's involvement in the private sector is largely restricted to ensuring that it employs the qualified staffs and adhere to professional standards. And second, the country basically relies on the command and control model rather than purchaser providers separation. So what they do that they train physicians to manage and lead healthcare delivery at every level, and they develop an effective management and supervision systems, and provide physician a space to operate within a certain amount of autonomy to maximize the service delivery and equity of access. And second is the Thailand's model. So they have, the government is spending much less than the other countries, but their healthcare indicators are much more brilliant. So what are they doing is that they have covered, sorry, they have covered 99% of their population in under any scheme of social protection, and their services are very comprehensive. They provide promotive, preventive, curative, rehabilitative. They have provision for transportation coverage as well, and the alternative medicine. So they are funded by the general taxation by the government, and everyone is provided the coverage regardless of their income and employment status. And they have seen that the general annual checkups have been improved, and the take-up is more among the women. Third is the India. So we have, the world knows that we have recently launched the Ayushman Bharat. So under this, we have the two components. One is the health and wellness center, and second is the Pradhan Mantri Jan Arogya Yojana. So we are providing the comprehensive primary care services through 150,000 health and wellness centers, and Pradhan Mantri Jan Arogya Yojana is providing health insurance cover of 5 lakh, which is around USD 6,000 per year, to over 10 crore poor and vulnerable families seeking secondary and tertiary care. So the services, the comprehensive primary care services which are provided under this, which is not, I would say, are comprehensive in truer term, but we are trying. So this is a maternal and child health, non-communicable disease, palliative and rehabilitative care, and oral eye, ENT care, mental health, and first level care of emergencies. So when we see at the numbers, when we look at the numbers, the hospitalization availed by women is 48% of total hospitalization rate. We have empaneled around 27,000 hospitals. The hospital admissions are being taken by the 5 crore
Dr. Kaur, can
Indians.
you conclude?
Yeah, please. So the key recommendation here is that the public funding, there should be a public funded system, and especially for the vulnerable population. There should be progressive coverage, start with the comprehensive primary care, and the digital health should be bring in when it comes to providing the universal health coverage. Value-based care should be the priority. We should look at the holistic indicators. UHC best practices toolkit, we should look at who all are implementing the universal health coverage, and we should have a toolkit, and this would minimize the mistakes. We should look at both the coverage and utilization of universal health. We should also focus on the wellness. So we should move from the sick-based approach to the wellness. We should have a UHC digital dashboard for the Asian countries. So we should have, for having data-driven insights for action, and a preemptive care model where we just do not prevent the disease, but also preempt. So thank you so much. Thank you so much for the listening.
Okay, thank you very much. So now we have our last speaker, not least, Masaki Inaba from African Japan Forum, and he's talking about more role of this country in supporting universal health regime in developing country and LDCs. So Masaki, over to you. You can speak 7 minutes. So share your experience.
Okay, yeah, thank you very much. Arjun, thank you very much, and everybody, thank you very much. And my name is Masaki Inaba. I'm from Japan, and I'm from Tokyo. Yeah, thank you very much. My title is that the role of richer countries in supporting universal health coverage regime in development countries and LDCs. And considering the title, I think that the role of the civil society in richer countries are sharing the experiences of our country on the universal health coverage, and also universal health, universal social protection, and also advocacy for richer countries to for its assistance policy on the UHC and also the universal social protection. So that I'd like to share our analysis on our systems and then show our roles on the the issues in the title. So firstly, I'd like to explain the Japan's history of the universal health coverage and the universal social protection first. Japan has a series of the comparatively developed public mechanisms and the systems of social protection. Sharing the information on the architecture of systems as well as the challenges from the civil society, especially the people left behind on the systems. So Japan's universal health, Japan's social protection system has the 4 elements. Firstly, public insurance. It is pension and the public health insurances. And the food resources are the mixture of the premiums paid by the people, premiums and the taxes. Premiums is paid by the people and the employers. And secondly, the social welfare. It is tax-based and the various programs designed for each peoples, including people with disabilities, children, elderly people, etc. And thirdly, public assistance. It is tax-based. And for the people in the most needy situation, for daily lives, house rent fees, medical services, and education and funerals. And fourth, and lastly, the public health. It is tax-based, provided by the public health centers and including the immunization for the children, etc. And the good points of the GA's social protection system in Japan is that firstly, it ensures access to minimum standardized essential health and medical treatment for the most of the diseases, including non-communicable and communicable diseases in affordable price in both public and private hospitals. It is due to the fixed prices for medicines. And also the another financial mechanism called the high cost medical care insurance system. And this fixed monthly and this high cost medical care insurance system is that meaning is that has a fixed monthly price for the high cost treatment and a combination of the health insurance and the social welfare to ensure affordable access to medicines, such as the antiretroviral treatment on HIV/AIDS. And also, it provides the comprehensive and integrated approach for the aged care and medical services for the elderly in public nursing home for elderly. It shows low mortality rates of the COVID-19 in Japan, even in emergency situation, pandemic also. And in Japan, as the super aging society in Japan, the community-based comprehensive care system approach works for the quality of lives of the older people in Japan, ensuring that living in their villages and towns. This is a good point. And the challenges, there are many, and there are significant challenges there. Access to services for marginalized population, especially migrants. The migrants undocumented or lost their stable residential status with with various reasons. They are denied most of the access to the most of the the services, and also access to information has been hampered by linguistic barriers, and this is very much severe problem. And also several barriers for the people in vulnerable situation systems sometimes lacks necessary consideration on gender, sexual orientation and gender identity, physical and mental disabilities. And also vertical structure between the providers and the recipients. And many people who have been already stigmatized tend to escape from these social pressures because that has these kind of vertical and also paternalistic structures of the these social welfare systems. And social stigma for the people who are recipient of the public assistance. It is very much severe problem. And there have been a series of campaigns in both traditional and the social media against the people who receive the public assistances. And many people who are eligible to receive the public assistance have been excluded from the accessing the public assistance programs. And finally, the aging of population has put the sustainability of the system at risk. as expenditures for service provision have been becoming much larger than revenues from the insurance premiums and the other sources. So these challenges are there. But anyway, despite these many challenges, the systems of Japan have been comparatively working and functioning well to cover the people. And it is because of the sustainable reviews and evaluations from the people since the end of the World War II. These have been continued. There have been continued efforts of many civil society organizations and communities to demand social protection programs, as well as monitoring, evaluation, and advocacy to make these programs properly working for the people. Without these efforts of direct civil society efforts, there won't have been well-functioning social protection systems. Actually, civil society has been advocating the government of Japan to secure the rights of the access to emergency medical services for undocumented migrants, and that is not currently secured by the government. And the challenges of Japanese social protection mechanisms, especially aging, the challenges of all the countries in Asia Pacific region, because many countries in Asia Pacific region have been already facing it. Our experiences of social protection will be useful for the countries of Asia and Pacific, especially civil society. A good point of the role of the richer countries is to show the models of national social protection, providing expertise and experiences, and sharing the technology of management of social protection programs, and take the leadership for universal social protection. We can praise the Japanese government has been taking the leadership to achieve universal health coverage, which is a target of the SDG 3.8. We, Japanese civil society, has been working to encourage the Japanese government to keep the championship of universal health coverage and advocate it to work more with multi-stakeholder approach, including civil society and communities. So thank you very much.
Thank you, Masaki, and sharing the Japan government strategies and social protection. So now I like to invite again Pradeep to handle in this open discussion. So we don't have much time, so we'll go not more than 10, only the 10 minutes we have left, but already we are very late, like at least 10-15 minutes late. So Pradeep, can you handle this discussion?
Okay, thanks Arjun Bhattara for moderating it. We had great speakers from global to regional to national, and from communities also, discriminated communities, presenting the state of social protection. We actually have exceeded time allotted to us by the UNESCAP, but it's all right. Can we have one or two questions and 5 minutes of discussion? Hi, Awal Bhai, please go ahead.
Thank you, Pradeep. And first of all, the whole discussion was really enriching discussion, and it is really very much needed to exchange the experiences of different countries, how the social protection system is working for the people who are vulnerable and excluded. Regarding the experience of Bangladesh, I just raise one or two issues. In Bangladesh, we have social protection policy. It has been a long campaign of civil society organizations, and in 2015, Bangladesh government has accepted and endorsed a social protection strategy paper and committed to make this as a law and to prepare a plan of action to implement that. And there it is saying that it is the full life scale program from a child born and until the death. So this is one thing. But historically, Bangladesh has been providing some support to the vulnerable specific groups. That was very little, and there was a criticism. And in Bangladesh, now we have food distribution and cash transfer programs basically. But last couple of years, government is planning new social protection activities like a social insurance program and also pension program, a contributory pension program, though civil society have been campaigning for a compulsory insurance, compulsory pension program for all. So we are in a better situation in terms of policies. But if we consider the actions and the program, it's really very poor because the budget allocation are not increasing. So I am just concluding here that the whole discussion is really enriching. And if we, GCAP, can take some initiative to compare all the experience of different countries in South Asia and Southeast Asia, that will be very much helpful for our campaign in Bangladesh. So I'm just concluding here that it's a really very nice discussion. Thank you very much for Pradeep, Arjun, and all the speakers who have spoken. Thank you.
Saray Sam, very brief 1 minute.
Yes, thank you very much, Mr. Bradham, and thank you for the opportunity to take part in this forum. Yeah, and thank you all speakers that presented great presentation about social protection, especially Sylvia, who introduced to be a member of Coalition for Social Protection that we advocate for protection all human rights and everywhere around the world that is affected by the human abuse. What I would like to share today is that the Cambodian ruling party fell to this social protection, yeah, and they try to ignore about the international norm, especially universal declaration of the human rights. So I try to advocate at the international community to better human rights and peace in Cambodia. That's why I would like to call like a coalition and United Nations to do something to protect all human rights and to make peace so that we can solve this problem together. Thank you.
Thank you. A last comment or question? Really last. Okay. Silence means we do not have any questions. I would like to invite Sin Puthiari, the Executive Director of Cooperation Committee of Cambodia and member Global Council GCAP, to give the vote of thanks.
Thank you, Pradeep, and thanks everyone for the participation, the whole day sessions and this evening, especially on social protection. And this is what we're aiming for. It's not about just the social protection itself, but most of us feel very, very inspired by how we can contribute our dedication of our speech, our understanding, our knowledge toward the social protection, because we believe that that is the beneficial to the vulnerable, the poor, the marginalized groups that are not able to have that privileged platform to those kind of discussion, especially on the very high level, such as the United Nations discussion like this. So this is, I think, very crucial and up to our role as civil society, especially on the global level. All we work together to show the solidarity of our commitment, our contribution to those vulnerable groups. And on behalf of the organizer, as well as part of GCAP committees, we would like to thank our guest speaker who provide very knowledgeable information, as well as some recommendation or strategy forward to move ahead together in such a very dynamic context. So once again, we hope to meet again soon on the social protection, because even the program end here today, it does not mean that we end our conversation. So thank you so much, and wish everyone have a nice evening and enjoy your stay during APFSD. Thank you.
Thank you. Thank you, Sin.
Thank you.
Thank you, colleagues. Bye-bye. Let's close it here. Bye-bye.
Bye-bye. Thank you.
Bye.
Bye.
Bye-bye.
Thank you.
Bye-bye. Thank you so much. Bye.
First,
Bye-bye.